Hello, today I'll be talking to you about autism spectrum disorder, also referred to as ASD. So, what is ASD? ASD is a developmental disorder that can cause significant social, communication, and behavioral challenges. According to the CDC, about 1 in 68 children have been identified with autism spectrum disorder. It is reported to occur in all racial, socioeconomic, and ethnic groups, and it is 5 times more likely in boys than it is among girls. You can detect ASD in your child as young as 18 months or younger, and by the age of 2, a diagnosis by an experienced professional can be considered very reliable. So, throughout this speech, I will be talking to you about the symptoms, causes, and treatment for ASD. So, what are the signs and symptoms of ASD? People with autism spectrum disorder have certain behavior and might not want to change in their daily routines. Parents are usually the first to notice ASD in their child. You can detect ASD in a baby just by a couple of months. Some signs that your baby might have ASD is that they are focused on certain objects, rarely make eye contact, and fail to play back and forth with their parents. Some children might not show symptoms until year 2 or 3 of their life. Some signs that they might be developing ASD are they lose interest in others, become silent, and withdraw from other people. Some other signs to look for if you think someone has ASD are that they avoid their eye contact with you and they want to be alone constantly. They prefer not to be held or cuddled or only cuddle when they want to. For example, my brother Dylan, he has ASD and he never wants to cuddle. But then there are those rare days where he comes up to me randomly and he'll sit right next to me and he'll pull up his blanket and we'll watch TV and he'll cuddle with me for hours. They repeat words or phrases. They repeat actions over and over again. They don't play pretend games. They have trouble adapting to their routines changing. If they have a certain order how they do things, they get up at a certain time, eat breakfast at a certain time, they don't want it changing. They want to follow it constantly every day. Some other symptoms to look out for with those who have ASD are social skills, communication, and unusual interests and behaviors. Some social skills that you might need to look out for are that they only interact to achieve a certain goal, they're not comforted by others during distress, and they have a hard time developing friendships and have a hard time learning how to share. And because of this, some kids might not want to be their friends. And social skills are one of the most common symptoms in those with ASD. When it comes to communication, about 40% of children with ASD don't talk at all, and about 25 to 30% of children with ASD learn some words by 12 to 18 months and then lose them. Like my brother, for example, he didn't learn how to talk until he was about 4. They learn to communicate using pictures or their own sign language, and they are unable to combine words into meaningful sentences. Some unusual interests and behaviors that they might have are that they line up their toys in an order in a certain way, and if you move one out of the order, they can throw a tantrum. They're very organized. They might flap their hands, rock their body, or spin in circles, and they thrive on routine. Just a simple change in their routine can cause them to have a tantrum or a meltdown. So now that we know about the signs and symptoms of ASD, let's talk about the causes of ASD. When it comes to the cause of ASD, there isn't one specific thing. Instead, there are 2 things that doctors believe cause ASD in a person, which are genetic factors or the environmental factors. So let's talk about the genetic factors. According to the CDC, 9 out of 10 cases shows that identical twins with the same genetic code, if one twin has ASD, then the other twin could have ASD. For example, my brother Dylan, he is a twin. My other brother Colin, who's his twin, is on the high spectrum of ASD and doesn't show as many signs and symptoms of him having ASD, but we've had them tested. Dylan, on the other hand, shows a lot of the symptoms of ASD. Researchers are starting to find that particular genes, such as the Fragile X syndrome or tuberous sclerosis, could be the cause of ASD. Now, tuberous sclerosis is a rare multi-system genetic disease that causes benign tumors to grow in the brain or on other vital organs such as the kidneys, heart, eyes, lungs, and the skin. Now, the Fragile X syndrome is an inherited condition characterized by an X chromosome that is abnormally susceptible to damage, especially by folic acid deficiency. Some environmental factors that might cause ASD are that during pregnancy, if women were to take the prescription drugs valproic acid and thalidomide, then their children might have a higher risk of having ASD. Also, if a woman is older when giving birth, then her child is already at a higher risk of having the ASD disorder. Since we have learned about the causes of ASD, let's learn how we can treat the disorder. There's no proven cure to treat someone with ASD, but there are a few ways to reduce the symptoms of ASD. Some types of treatments for ASD are behavior and communication approaches, dietary approaches, medications, and complementary and alternative medicine. A treatment for those with ASD is applied behavior analysis, also referred to as ABA. It encourages positive behaviors and discourages negative behavior in order to improve their skills. There are also some therapies that help children with ASD, which include occupational, sensory integration, and speech therapy. My brother Dylan and Colin have both gone to occupational and speech therapy. When it comes to occupational therapy, it teaches skills that help the person live independently. So when they went to speech therapy, they taught them how to dress, how to use their forks and spoons, how to eat, how to take a proper bath, and how to relate to people. That way they could do it on their own and not have to depend on my mother to do it for them. When it comes to sensory integration therapy, it helps the person deal with the sensory information. It could help a child who is bothered by certain sounds or doesn't like to be touched. When it comes to speech therapy, it helps improve the person's communication skills. Some are able to learn verbal communication skills, while other times it helps the person by using gestures or picture boards. So instead, if they can't physically learn how to do communication skills by speaking, then instead they have like little picture boards of like a cup or a spoon or the bathroom, and the child with ASD will point to them, showing that that's what they want. They want the spoon, they want the cup, they need to go to the bathroom. So that's their way of communicating with us. Another way is dietary approaches. When it comes to dietary approaches, it's not something that specifically helps all children with ASD. It could just help one child. Some therapists believe that if you were to take out one thing in a child's diet who has ASD and replace it with vitamin supplements, then it would able to help like with them during the day and not like have so many tantrums or not get upset as easily. Like with my brother, for example, we have changed some things in his diet, and he acts a lot better now. He doesn't have as many tantrums as he used to. So it's not something that will help all children with ASD. It only helps some with ASD. Now let's talk about the medication. There is no medication that cures ASD, but there is medication that people with ASD can use to help their inability to focus, if they're depressed, or if they have seizures. So, now that we have learned about the signs, symptoms, causes, and treatments of autism spectrum disorder, it is a developmental disorder that can cause significant social, communication, and behavioral challenges. So, parents who believe that their child might be affected by ASD can get help and have their child evaluated. Although there is no cure for ASD, there is always a way for the child to get help, whether it be medically or therapeutically. So those who suffer from ASD or are experiencing the symptoms can get help and learn how to live an independent lifestyle on their own. Thank you.